Welcome to the nursing labs and simulation rooms. This video will provide information about these areas to better prepare you for lab and your simulation assignments. First, we will be discussing the lab guidelines. Lab guidelines are necessary to ensure that faculty and students are aware of the lab rules, know where equipment and supplies are located, and to promote a safe practice environment. All faculty and students must wear a uniform and adhere to the uniform guidelines in the Student-Faculty Handbook. All faculty and students must ensure that their hair is above the collar according to the Student-Faculty Handbook. All faculty and students can only wear one set of earrings that must not dangle, and no artificial nails, either gel or acrylic, can be worn in the lab or simulation rooms. No students are allowed in the nursing labs without a faculty member present. Students must report latex allergies to the nursing director. No eating or drinking is permitted in the labs. All backpacks, personal items, water, etc. must be secured safely in the bins located by the front doors of Lab A or Lab B and both of the debrief rooms. During scheduled breaks, please step outside of the lab and the debrief rooms to eat or drink to prevent a spill and damage to equipment. Any malfunctioning or broken equipment must be reported to the lab faculty immediately. Dispose of glass ampules, needles, and syringes in the red sharps container. All adjuncts participating in simulation must check their Estrella emails at least once a week. You will receive the simulation scenario as well as your role during the simulation experience at least 1 week prior to the simulation. All adjuncts participating in the simulation must contact the lead faculty immediately if for some reason they are unable to attend their scheduled simulation date. The Board of Nursing has specific requirements for the number of staff per student during simulation, so we would have to find a replacement or cancel the simulation. No students are allowed in the simulation control room. Please refrain from queuing the students until lead faculty begin facilitating the debriefing process. The purpose of debriefing is for students to critically think, reflect on the recent simulation experiences, and have those crucial aha moments. We realize that you are the subject matter experts and you will have ample time to offer your expertise and guidance during the debriefing process. Lab A and Lab B are utilized for all nursing blocks, blocks 1 through 4, and have a variety of mannequins ranging from low to high fidelity. These labs are set up like patient wards, and each bed is separated by a curtain for patient privacy. You will find 2 high-fidelity mannequins on Lab A side, Hal, a simulation man, and Cinderella, a simulation baby. You will find Noel, a mid-fidelity mannequin, which gives birth, and 3 vital sim mannequins, which are low fidelity. These are 2 sim adults and 1 sim child we call Jacob. The simulation control room separates Lab A and Lab B. This room is for faculty only. It houses a state-of-the-art audio-visual system utilized to run, record, and playback simulations. This system also allows for the viewing of live simulations in the 2 debriefing rooms across the hall from Lab A and B. Hand wash stations are found in both Lab A and B on the back walls. Hand washing is mandatory when entering the lab as it is a patient environment. Also, hand sanitizer can be found in multiple locations throughout the lab. Eye wash stations are also available and are located in both Labs A and B on the back walls for eye emergencies. There are 2 long-term medication carts and 1 medical surgical cart. They can be found in various locations in the nursing labs. They are mobile and are moved to either Lab A or B according to the lead block instructor's request. Linen cabinets are located in Lab A and B on the back walls. The contents are as follows: towels, washcloths, fitted and flat sheets, and blankets. There are 2 hospital supply cabinets located in Lab A. These cabinets have all the supplies needed to practice skills and participate in a simulation. The first cabinet closest to the simulation control room is for Block 1, and the cabinet next to it is for Blocks 2 through 4. If there are not enough supplies in the cabinet, please contact the lab faculty. Only faculty are permitted in the nursing supply closet located in back of the Lab A. The debrief rooms are located across from the A and B labs. Students and faculty meet in these rooms to plan for the day's events, receive instruction, view simulations, and participate in debriefing. Students are not permitted in the debrief rooms without a faculty member. Ensure that doors are locked if students or faculty are not in the debrief rooms. On simulation days, there must be a faculty member with students that are viewing and critiquing live simulation events in the debrief rooms. On lab days, faculty will be facilitating student learning as assigned by the lead faculty in the debrief rooms. EMCC nursing labs provide the students and faculty with a professional and safe setting for instruction. It is important that we remember that the mannequins in the labs are not real, but your words and actions are real, and that the situations presented during simulations mirror situations in the real environment. Because of this fact, we must treat our mannequins as real patients.